Hi, welcome, and thank you for joining our Team Up Take Action breakout session on food insecurity. Before we begin, there will be a poll on the right-hand side of your screen. If you could click on that and give us a little feedback, we'll come back to those results in a little bit. Next slide. First, we'd like to give a big thank you to the conference planning team. This is a collaboration between Dartmouth-Hitchcock, New Hampshire Public Health Association, and the Vermont Public Health Association. A few things that you should know. On the next slide, all participants are muted. You can submit questions for our speakers using the Ask tab on the upper right-hand side of your screen. The speaker icon brings you to the bios for our speakers, and the participant icon lets you see who else is attending. The message icon allows you to see any messages you've sent and received. Also, the sponsors icon will show you information about our generous sponsors. The program evaluation icon is where you will go to provide feedback to us on this event. And all slides will be posted on the New Hampshire Public Health Association website. All faculty presenters and moderators have completed disclosures, and there are no conflicts of interest. Next slide. For continuing education, an evaluation link is available on the conference platform for each day of the conference. To receive your continuing education certificate, you'll need to complete this evaluation online. Your certificate will be emailed to you after completion. The evaluation link will be closed on December 4th. So with that, we'll say welcome to our panel, Keeping Food on the Table, Community Collaborations to Meet COVID-19 Food Insecurity Challenges. I'm Chelsey Canavan from the Population Health Department at Dartmouth-Hitchcock, where I focus on our community food and nutrition programs in New Hampshire and Vermont. I'll be your moderator this afternoon. We have 3 panelists. Each of them will give a presentation about their work, and then we'll ask you to please enter your questions for our speakers using the Ask tab throughout their presentations, and we'll have time for Q&A at the end. So we're really fortunate to have a very diverse group of experts with us today, and I'd like to introduce each of them briefly. Our first speaker is Lyndsey Haight, the Executive Director of Our Neighbors Table, a post she's held since 2010. She says her greatest achievement is when Our Neighbors Table declared Amesbury, Massachusetts, its first food secure city in 2018. She now leads the organization towards its vision of establishing universal food access across all 12 towns of Massachusetts' northeastern Essex County by 2029. Lyndsey has worked in the social work field and has 20 years of experience in nonprofit administration and leadership. Prior to Our Neighbors Table, Lyndsey served as the Executive Director for Dorchester Cares Coalition for Families and Children. She's led national and local fundraising operations at the National Brain Tumor Society, among other partners. Lyndsey earned her Bachelor of Social Work degree at Plymouth State University and her Master of Social Work at Salem State University, and holds a certificate in Nonprofit Administration and Finance from Suffolk University Sawyer School of Business. Mike Apfelberg is the president of United Way of Greater Nashua. He's been in this role for 5 years, focusing on the health, education, and financial stability of the community. United Way serves the 11 communities of Greater Nashua, which include Hudson, Nashua, Merrimack, and Milford. During the COVID-19 pandemic, United Way has focused its efforts on direct support for local nonprofits to continue meeting client needs, food supports for children and families, sourcing of PPE to keep the community safe, and critical supports for students, including access to the internet, supplies, and technology. Prior to joining United Way, Mike was a small business owner in Nashua and also worked for 20 years in the printing and publishing industry. Mike is a member of the Greater Nashua Public Health Advisory Committee, the Greater Nashua Continuum of Care, the Greater Nashua IDN, and serves as a commissioner on the State Board of Higher Education. John Sayles joined the Vermont Foodbank as CEO in 2009 after serving 10 years in senior appointed positions with the state of Vermont at the Agency of Natural Resources and Department of Public Service. John serves on the board of Feeding America, the nation's largest hunger relief organization. He was presented the 2012 Global Public Service Award by Feeding America for his contributions in public policy development. He's also vice chair of Feeding America Eastern Region and member of the Food Sourcing Advisory Committee. Outside of the Food Bank, John is on the boards of One Care Vermont, the Vermont Health Foundation, and the Vermont Business Roundtable. Prior to coming to Vermont, John practiced law in Maryland, both in private and government practice. He's a graduate of the University of Baltimore School of Law and Frostburg State University. So we're really delighted to have each of you with us today. And without further ado, I will turn it over to John to get us started.
Thank you very much, and I'm really excited to be here. As you heard, I'm John Sayles. I'm CEO of the Vermont Foodbank, and I'm just going to get right into it. So the Vermont Foodbank, just tell you a little bit about us. Like the food banks in New Hampshire and Maine, we are the only food bank in the state. We cover the whole state and have a number of programs, as you can see up here. Veggie Van Go that you see in the center is our mobile fresh produce distribution program. And 3 Squares Vermont, as most of you probably know, is the Vermont name for the SNAP program. Backpack is our school program, and Gleaning and our network partner distribution. And VT Fresh is fresh food education, cooking demonstrations, and nutrition education program. So the vision that the Vermont Food Bank has is really a public health vision. It's that everyone in Vermont has access to enough food every day, that everyone in Vermont is healthy, and that everyone in Vermont takes action to eliminate hunger and poverty. And we've been using for a while this kind of public health model of this cycle of food insecurity, where coping strategies of eating poor quality food lead to chronic disease, or worsening of chronic disease, increasing healthcare expenditures, making it more difficult to succeed at work and school, lowering household incomes, spending trade-offs, and you get stuck in this cycle, which is really a cycle of chronic stress. What the food bank, we see our role as working with the partners in all those other areas to really create off-ramps so that families and individuals can find that that more virtuous cycle of food and financial security. COVID-19 obviously has impacted people in Vermont and across the country in really significant ways. So prior to COVID, we were serving roughly 150,000 people in Vermont in partnership with about 300 organizations, food shelves, meal sites, homeless shelters, after-school programs, senior centers, hospitals and schools where we did our Veggie Van Go. Then COVID hit, and so many people lost jobs. Food insecurity was up 46%. For children, 60%. We're serving at least 200,000 people in Vermont now. It's kind of hard to keep track. UVM's doing some great work on doing some surveys and helping us understand really the impact of COVID on food security in Vermont. I think we all agree here anyway that 3 Squares Vermont, the SNAP program, really is the solution here, or one of the really best solutions. Unfortunately, the federal government has not stepped in. What we really need is benefits to be increased and eligibility to be broadened. I think if we saw some significant increases in SNAP benefits and eligibility, we wouldn't be seeing these huge increases in food security related to COVID. So the food bank, we see our role as in the face of federal inaction in really finding ways to fill in those gaps. And some of those are the Veggie Van Go, the Farmers to Families food boxes, which is a federal program. I'm sure most of you have heard of that. And I'm going to talk about, I also want to mention school meals. It's been a huge effort by schools across the country to make sure that the kids are getting fed. And bravo to that effort. But I'm going to talk about a couple of the efforts that kind of popped up, and we were able to leverage existing relationships and do some new things that I hope will actually continue post-COVID. One of them is a culturally responsive food project in the Burlington area in Vermont. We all know that COVID has impacted the health of Black, Indigenous, and people of color communities, and also their food security in greater ways than in the white communities in our country. We had some funders reach out and want to specifically address that disproportionate impact. We were able to work with partners that are already partners of the food bank, the Diggers Mirth Collective Farm, which is at the Intervale in Burlington, and the Janet S. Munt Family Room, which is a parent-child center that serves a lot of new American families, primarily Somali and Nepalese, that have settled in the Burlington area, and really robust communities there. The project itself, the local farmers markets, where a lot of the new American communities got the foods that are relevant to their cultures and the way they cook and eat, shut down. So this program is funding 55 shares from Diggers Mirth, really farm shares that are being home delivered by the family room to primarily Somali and Nepalese families. And there's about 300 individuals are being served, and in total, through the grant period that we have so far, we'll serve about 825 home deliveries. As I said, it's been really challenging for communities because the farmers markets have shut down and reopened and shut down again. And that's tough on the farmers and on folks looking for those culturally appropriate foods. A really exciting part of this to me, and probably to a lot of public health people, is that this is also a research project. We were able to get some funding actually through the federal government, through our congressional delegation, and UVM, and some folks who are actually participating in this conference and have been, and the UVM Medical Center, along with the Food Bank and the Association of Africans Living in Vermont, are doing surveys and interviews and analyzing that data. We'll be providing recommendations, but also there'll be some articles written and published. And I'm hoping that this will give us some leverage and a bounce to really keep doing this program and expand it to other communities throughout Vermont. So in addition to this, we're looking more broadly too, and the COVID has impacted people in new ways around food insecurity. One of the things we saw was just the stress and the people's inability to get to food shelves, but it's just more challenging to get those meals together. Well, as soon as COVID hit and restaurants were closed, Benji Adler, who's the owner of the Skinny Pancake Restaurant Group, which is in the Burlington area, responded by creating shift meals. He wanted to make sure that the workers that were laid off in his restaurants, as well as other restaurants in the area, were able to eat, because he knew obviously the impact on them. So shift meals started, and the Skinny Pancake used their catering kitchen and started preparing and freezing meals, and then doing weekly or bi-weekly meal distributions just out in front of their restaurants. Benji is a man who has a lot of ideas and a lot of energy, reached out to the food bank and some others and said, hey, we can do more than we're doing. And we agreed. And with Skinny Pancake's help, we've been partnering with Shift Meals and actually purchasing meals that are prepared and then delivered by Shift Meals to network partners of the Vermont Food Bank, really focusing on the most vulnerable populations. And so far, we've done about 48,000 meals and going. So we're very excited about that. Here's just a list of some of the partner organizations that Skinny Pancake is delivering to, which also helps preserve the Vermont Food Bank's transportation capacity. So we don't have to roll our trucks. They're rolling their delivery and catering trucks to make these deliveries. You can see the meals are labeled with ingredients and allergens and safe food handling. The recipes were developed in partnership with the food bank and some nutritionists at UVM to make sure that we're meeting the nutritional needs of the folks we're serving. And there's vegetarian and vegan options, which is something that isn't always available when you're kind of shopping at a food shelf. The meal sites really have found this helpful. Again, it's something that we hope we can continue. I just wanted to share Asho's comments. She has 2 kids an infant and a 1-year-old. And she said the meals have been incredibly helpful and have made a huge difference in our life. Since COVID and the birth of my baby, we've regularly been running low on food. And the frozen meals help us get through the week and make sure my kids have enough food. We're currently on food stamps, and I go to the food shelf when I can, but family room deliveries and the food bank food make it possible for us to eat regularly. And I think, again, that highlights the inadequacy of the Three Squares Vermont program and SNAP nationally. People are getting benefits, but it's still not enough to make sure that their families have the nourishing food they need to grow and learn and really be active participants in our communities. So thank you all. I look forward to hearing some questions, and I look forward to where these programs take the food bank in the future. We've been learning a lot. And I think I'm going to turn it over to Mike now. And you're on mute, Mike.
Yeah, I know. You know, we practiced this session multiple times. I think we all spend our lives on Zoom these days. And I think the phrase of the year is going to be, "You're on mute." So as introduced, my name is Mike Apfelberg. I'm the president of the United Way of Greater Nashua. Just by way of putting that into context, there are actually 5 United Ways in the state of New Hampshire, one very small United Way serving Sullivan County, then the United Way of Greater Nashua serving the southern tier, Monadnock United Way serving the Peterborough / Jaffrey / Keene region, and Seacoast United Way serving the Portsmouth, greater Portsmouth area, and then the largest United Way of the state, which is Granite United Way, going from Manchester up to the Canadian border and through the Upper Valley. So we serve the 4 communities, actually 11 communities, but the 4 larger communities in southern New Hampshire, Nashua, Merrimack, Hudson, and Milford, and so smaller surrounding towns, and have done so for 90 years now. Our focus is, generally speaking, to support initiatives which fight for the health, education, and financial stability of every person in our community. And then once in a while, we have a global pandemic and we do something else. Next slide, please. So does everybody remember March? I'm going to take you back through what for me is now starting to feel like a very, very long time ago. You know, somewhere in January, February, we started to become aware of the growing coronavirus impact globally, and started to sink in that this was something that was going to perhaps affect us locally. And then somewhere in the middle of February, things started disappearing on the shelves. And I think we all can remember that. And probably someday we're going to tell some pretty humorous stories about the days of us going from supermarket to supermarket, trying to find just that one lonely roll of toilet paper left on the supermarket shelf. Well, in our community, we saw immediately that this began to impact our local nonprofit agencies. And this is where, for our United Way and for many United Ways across the country, we began to pivot our work to support what the immediate needs were of the local community. And it, quite frankly, began with toilet paper. It was literally as simple as that. We started getting calls from local nonprofits saying, we don't have basic supplies for our clients. We need hand sanitizer, we need gloves, we need face masks, we need toilet paper. And most of the nonprofits in our community are small organizations. They have struggles day in and day out to find the resources in normal times to support their clients, let alone the unusual needs that crop up in a global pandemic. So we took a quick pivot and looked around our very small organization, which is frankly 4 full-time employees, including myself, and said, okay, let's switch gears here and figure out how we can support our community. One of my employees, Liz, is our community impact director. Normally, she is the person who works with agencies on their grants, helps them to collect data on the impact that they're having in the community, and helps them to adjust their programs to be impactful in the ways in which we envision them. somewhere around the 1st of March, I called Liz and said, all of that is really important. Set it aside for now and call everybody you can and see if we can find some toilet paper. That is an unusual phone call and one that I really never thought that I would be making. But that's what we did. A couple of weeks after that, we, in New Hampshire, started to sense that things were going to shut down. And somewhere around the 13th of March, Governor Sununu announced that all of the schools in the state were going to be going to a remote learning model. And on March 16th, which was a Monday, I called the president of our local teachers union, who is a very supportive and great partner of ours, and said, Adam, what can we do to help you through this process? And he said, I'm glad you called, because today I had about 300 volunteers from my teaching base handing out food at 16 of our schools to kids, and they loved it, and it was a great thing for them to do. But on Wednesday, they have to start teaching classes, and they have to figure out how to do this. Can you help me with that? And again, a phone call I never thought I would participate in. And we said, yeah, we can help with that. And we just figured out that we needed to shift all of our efforts into food supports. And that's how United Way got into the food business. This is a business we've never been in before, but it is certainly one that we've been able to work through. So initially, as I said, our involvement with food supports in our community was through our schools programs, which, as John mentioned, throughout the country, schools went to a model of distributing breakfasts and lunches, lots of different ways, but in our community, it was breakfasts and lunches that were available 3 days a week to any student, not kids on free and reduced lunch, no sign-up criteria, any student in the community who just said, I need food. And they could get that initially at the schools. We set up about a dozen schools where you could come for a couple hours, Monday, Wednesday, Friday, with your parents, without your parents, as a neighbor. We didn't ask any questions. We didn't take any names. We just gave out food. Then we got a call from our local bus company, our Nashua transportation system, not the school buses, the city buses. And they said, you know what? We know you're doing this food thing, and we want to know if we can help out. And we said, well, yeah, I think we can work together, because I looked at where we were. And for example, we have 3 middle schools in the community of Nashua. But a lot of the kids that go to those middle schools are quite a distance away from their local school, and they had no way to get to the school for food. So I pulled out a map of the city, literally pulled out a map of the city, and sketched out 4 bus routes that we started driving literally the following week, where we handed out food on bus routes across 24 different locations in the community, on top of the dozen or so that we were already doing in the school. Yeah, so that was great, big successful effort. And then we got a call from our soup kitchen, which is an organization supported by the New Hampshire Foodbank, John's sister organization here in New Hampshire. And they said, well, we'd like to start distributing fresh produce and frozen meals to some of the people who are on these routes and these programs. Can we do something about that? And we said, yeah, we can. So within about a week after that, we had a program that was up and running, where at all of our schools and on all of our bus routes on Fridays, we had a collaborative partnership where the Boys and Girls Club would pick up food from the soup kitchen with their vans, take it over to one of the high schools. The high school would work with all of our volunteers to break down all of that food and distribute it amongst all of the schools and all the bus routes, and out it would go. So now we have this partnership, which includes the school system, which is the city's, which is a city department, the transportation system, also a city department, the soup kitchen, a nonprofit, the Boys and Girls Club, which normally also doesn't do any of this stuff, and a whole bunch of United Way volunteers handing out food. And it just grew from there. So between March and September, when the program pivoted to being run by the entirely by the school system, over that 6-7 month period of time, we were able to hand out over 100,000 breakfasts and lunches in our community to basically, as I said, just kids who needed food. No qualification criteria, no signups, just come and get it. And we did that through an all volunteer effort. A couple of other food initiatives I wanted to highlight, and partially because I'm proud of the impact, but also because I'm proud of the partnerships that we put in place to make this happen. We established a system of pop-up food pantries in our community, again, in partnership with our soup kitchen, but also this time in partnership with our YMCA, also not an organization that normally does food. Y called and said, we have some people who want to volunteer. They can drive our vans a couple days a week. And so we set up at on 5 different days, 10 different locations in the community where people could come and get fresh produce, and on Fridays, frozen meals. And that program actually continued for several months and actually only concluded about 2 weeks ago. And it didn't really stop. What we've pivoted to now is an indoor program that'll run through the winter, which I'm glad we did, because it's about 20 degrees out today. And I don't have any volunteers that want to stand out in the cold when it's 20 degrees out, but they will stand at the YMCA in their indoor facility and host people. So over the course of the months since we started that program back in April, we've now served about 8,000 families with fresh produce, frozen vegetables. Again, just come and get it. That's the whole idea, is come and get it. Again, through partnerships. A couple of other quick initiatives I'm going to highlight, and then we're going to go on to our next presenter. One thing we noted early on is we started to have families being quarantined. And we also had families who normally relied on their caregivers, say from an agency that works let's say the Caregivers is one of our local agencies that helps to shop for food and supply food. They were not able to visit their clients anymore because of coronavirus. And also people who normally would do their own shopping, but were now quarantined, couldn't go and get food either. So we actually set up an online grocery shopping system at United Way of Greater Nashua, which is all volunteer driven and operates to this day, where you can go online to our website, and regardless of whether you would pay normally for your groceries with your credit card, because you could, or you were on public benefits and we're going to pay with an EBT card, you could order your groceries through this portal, and a United Way volunteer would be deployed to do your shopping and bring you your food. And we've served clients for months and months now with the system. We have some regular clients who we deal with on a weekly basis, and we have some people who have become quarantined, have come in, have gone out of quarantine. And that continues to be a really great program. We're very proud of that, all volunteer driven. And if anybody has questions about that in the Q&A session, we could talk about that as well. Yeah, so last thing I wanted to mention is food drives. We know that we have a lot of agencies in our community that normally run food drives, but generally they'll partner with one supermarket or another, or have people from the community bring food. But nobody really has the bandwidth or the presence to be able to do a big community food drive at a lot of different supermarkets and corner stores all at once. So we've hosted now 2 food drives, 2 United Way food drives. Each of these has had over 30 grocery participants in them and has yielded literally over 20,000 items that we've then been able to turn around and break up and distribute out to our local agencies, including our soup kitchen, our Salvation Army, all of the food pantries in our community that distribute food. And that's been a great success and has really been a great way for the public to get involved. I should note that at all of these things, at our pop-up food pantries, at our food drives, at our school food distribution programs, throughout all of that, we've also distributed face masks and hand sanitizer to the public in an effort to allow people to have access to those things. In United Way's footprint, in our footprint, we have distributed at this point, actually the chart you're seeing is woefully out of date, which means it's 2 weeks old. We've now distributed about 150,000 face masks in our community. Nashua was an early adopter of a face mask ordinance that encouraged people to need face masks. And we just made sure that there's nobody in our community that can say, I'm not wearing a mask because I don't have access to a mask. They might choose not to wear a mask. Okay, I'm not going to get into that. But what I will tell you is basically what we did was we flew over Nashua essentially with a big old jumbo jet and dropped face masks everywhere we could. And we continue to do that to make sure that people who want access to that personal protective equipment have access to that. And that's the kind of how our food partnerships have worked and some of the impact that we've had. And that's about all I had. I think I had a second slide. You can go to that. Basically, that just highlights the collaborative partnerships that we've created. I think I said early on in my presentation, we were never in this business to begin with. We just found ourselves in a need to be in this business in March. And my message to everybody is that we all get accustomed to the work we do. And sometimes that work, in our case, that work was just not the work that needed to get done. And the work that we needed to do was distribute face masks, find PPE, hand out food, mobilize volunteers. All of these are the things that we pivoted to, but we couldn't have done it without partnerships. And the collective impact in our community has just been tremendous. Everybody has sort of, those traditional barriers between organizations where people say, you shouldn't do that because I do that. Or you shouldn't raise money doing that because that's my funder. And, all of those things, we've pretty much kind of set all that aside in our community. And I'm very proud of that. And have said, look, let's just do what needs to get done. And we'll sort it all out tomorrow when this is all over. And I look forward to any questions or comments that people have after our next presenter. Thank you.
Hi, everyone. Thanks for having me. It's a pleasure to be on a panel with John and Mike and Chelsey as well. And so my name is Lyndsey Haight, and I serve as the Executive Director for our Neighbors Table. A little bit of background about ONT. We are located in Amesbury, Massachusetts, and we serve 12 communities in the northeastern corner of the state. And like most food access organizations, our story starts with a small group of individuals who saw some of their neighbors struggling to put food on their table or living in isolation, and they figured, what can we do? And so they started, with a community meal, and it evolved into a small food pantry. So, our history is one that you have probably heard in your own community with your local food pantry or community meal program. And it wasn't until the last recession in 2008 when we really started to experience an influx of need. And I'll show you a map in a moment, but if you were to drive through any of our communities, you would not anticipate a high level of need. I know when I started 10 years ago, I had no idea the level of need impacting the community that I lived in. But in 2010, 2011, when the recession really started to ripple into our communities, it was clear that we needed a lot more than just a tiny food pantry in the back of a church or just one weekly meal. And so that's when we really started investing in our own infrastructure and thinking about how we could continue to keep our doors open and adequately respond to people. No longer were people coming to us in a time of emergency, but people really relied on our program and others like us to just maintain their household from week to week and month to month. And so we wanted to make sure that we were available and could respond in a way that was most helpful to people. So the picture that you see in the slide is of our central market located in Amesbury. We now have 2 of these, one in Amesbury and one in Newburyport. And it functions just like your traditional grocery store. 2 distinct differences. One, fresh fruits and vegetables, proteins, and dairy are at the center of our markets, not on the perimeters. And the other distinct difference is that people don't have to pay to access any of these groceries. So otherwise, it's a genuine shopping experience. There's no rationing, and with the asterisk that this is how we operated before COVID, but no rationing, and making sure that we had plenty of fresh fruits and vegetables, proteins, and things that people told us that they needed most from a program like ours. The things that they knew that they needed to be eating at home, things that they wanted to be able to provide for themselves and their families, but they were the most expensive items in the grocery store, and so therefore the least accessible when they were trying to, stretch every penny. So those are the things that we dedicated our resources to providing. So in 2016, we opened this market as part of a larger center. We have a warehouse that distributes to both of our central markets, as well as a network of 4 other pop-up markets that kind of come in, set all this up, and then break down because they don't have a permanent location. And those are located throughout the communities in partnership with our housing authorities, in neighborhoods for seniors and individuals with disabilities, as well as communities that just can't access Amesbury or Newburyport locations because we don't have a transportation infrastructure. So if you want to jump to the next slide, please. This just gives you a sense of where we are and the communities that we serve. So we are right on the New Hampshire border, right at the seacoast. And our region was carved out because it represented an area in 2008 where there were not existing programs or widespread networks of programming to provide food assistance. So it's a fairly large geographic region. As I mentioned, there's no public transportation infrastructure. Most of the communities are pretty rural. Amesbury and Newburyport are our biggest cities with about 17,000 people each. And again, if you were to drive through these communities, you would see a lot of big houses. There's, a history of industry and wealth in our region. But what you wouldn't see is the fact that in 2015, we had over 6,000 people who were living in food insecure homes based on data from our Greater Boston Foodbank and Feeding America. And that amounted to about 1 out of 5 of our seniors and 1 out of 8 of our children were living in food insecure homes, meaning that they were either worrying about or running out of food. And in 2019, we got updated data, and despite the booming economy, need across our region was up on average 10%. Newburyport had experienced a 17% increase in the rate of food insecurity. Salisbury community, very much sort of a transient, tourist-driven beach community, had experienced a 40% increase in food insecurity just from 2015 to 2019. So this is before COVID. And so we had been building our infrastructure, paying attention to this back in 2008. It wasn't until 2015 that we could get some hard data to help us really understand and plan for this need. But the level of data that we get from, Feeding America, which is an important partner in the Greater Boston Foodbank, really doesn't drill down to help us strategize in our local communities. So in 2018, we had launched a regional food security advisory group with mayors, town managers, all of the superintendents across our region, the local community hospital, and the largest pediatric practice. And we set out on a local assessment of food insecurity. And what we found there was that actually food insecurity was pretty evenly distributed among seniors, families with children, and single adults in our region. And that overwhelmingly, like 98% of respondents said that their primary barrier was not enough money. They didn't have enough money to access the kind of food and enough food that they needed to support themselves and their families. Actually, almost half of them were working or had a funded retirement at the time. So it wasn't just that we had a high rate of unemployment. Actually, at that time, we had a very low rate of unemployment, but still a rising rate of food insecurity. Anecdotally, some of the strategies that people think about, nutrition education, cooking classes, and things like that, I don't want to dismiss the value in some of those programming, but very few people, when in our regional assessment, we asked them what would be helpful to you in providing enough food to make your home food secure, what would be helpful. And overwhelmingly, people asked for discounted groceries or financial assistance to help them purchase food. Very few people said that a nutrition or cooking education class would help them make their family food secure. So when we talk about the importance of elevating the voices of people with lived experience, when they tell us what they need, it's really important that we respond to what they tell us they need, and not what we perceive as what will be helpful. And so our investments and our energy have been focused on providing them what they need. And so in 2017, we had actually launched a strategic plan, leveraging our food security advisory group and a regional network of food providers to ensure that we could at least make universal food access possible in the 4 communities in the northern part of our region where the need was concentrated most by 2020. Had no idea what 2020 was going to bring. And then in 2019, actually, we received a grant, a 10-year grant from a very generous foundation here in Massachusetts, the Cummings Foundation, to look out a decade. And we felt that there was no reason why by 2029, every single one of our communities could have universal food access. And so we have been sort of driving towards that goal since 2017, but with real focus since 2019. And just since COVID, just a note on the need, we had 1,400 new guests register for our programs alone at our Neighbors Table for March through September. And about 64% of them were children and their families. And so I think as you're hearing all day today, families, people who are working and relying on the workforce, and children who are now out of school, out of childcare, that they have been the most drastically impacted by this. Next slide, please. So as part of our journey, as my bio mentioned, our greatest achievement thus far was declaring Amesbury our first food secure city back in 2018. And this was not something we took lightly. And we had really been participating in a lot of nationwide learning around the definitions of food insecurity and food security and how to measure this. But really by 2018, we made this declaration with a fair amount of confidence. And our metrics were really based on, starting with food insecurity data and then comparing that to the consistent utilization of food programs over a period of 5 years. And looking at the infrastructure of food access points in the community of Amesbury and their sustainability factors. And in the end of 2017, so before we made this declaration, our local council on aging, as part of their biannual community needs assessment, had asked about food access, and fewer than 1% of seniors who responded, and there was a significant percentage of senior residents who participated in this survey, fewer than 1% identified food access as a concern. And when food access was no longer a concern for seniors, the number one thing that they identified that they needed support for was their mental health. And I thought that was such an incredibly powerful statement when you can provide for people's basic needs as they move up through actualization and quality of life, that they can focus on other things to support themselves and their families. Even in this pandemic, when we are seeing rates, particularly among families of food insecurity well into the upper teens, and for communities of color, significantly higher than that. At the height, the peak of the crisis in our area in July, when unemployment was at its highest, more than double than what it was in the 2008 recession. All schools were closed, and schools weren't even still providing some of their school year remote food assistance. Fewer than 6% of Amesbury families identified food access as a concern. Still too high, but in the middle of a pandemic and an economic crisis, we were actually faring pretty well. And we had the resources to be able to mobilize to find those families and make sure that they had access. So my hope today is to be able to share some of this learning with you. Go ahead, next slide, please. And to give you some of the foundational elements of our model. And I will say that there is no one set of programs that will meet, it's not a one size fits all. So every community is working with a different infrastructure, a different population. And so it is really important that communities build on what they have in place. And most importantly, that they recognize who is experiencing food insecurity and why. Going back to that regional assessment, it was really important that we heard from people why they could not provide enough food for themselves or their families, and to make sure that we were responsive to that. So, just taking a very simple visual of this three-legged stool, we believe that, the three major components of any model need to leverage the community's will and resolve towards food security, leveraging public programs, SNAP, WIC, school-based meals, other senior nutrition programs that are available through federal and state governments. If they're not available, advocating to make sure that those programs are available, and making sure that local resources make the food access points universally available. They need to respond to the particular needs of those who are experiencing food insecurity. An easy example is, when schools shut down in the spring, we had all these children who were in need of replacing their school meals. If all of our food access points only went through councils on aging, we were never going to meet the needs of those who are experiencing food insecurity. Making sure that they are universal, whether you can afford to shop at the grocery store or not, whether you're in a booming economy or you're in the middle of a global pandemic, those food access points need to be sustainable, and they need to be universally accessible for everyone. A huge part of our model is eliminating any kinds of qualifications and barriers that require people to prove that they need food. And so we do not test, we don't means test for any kind of food access points. And we feel that any community that is going to be food secure needs to have the majority of their food access points, if not every single one, be free of any kind of means testing. The quality and quantity, we all know that the definition of food insecurity is not just about the number of calories, but making sure that those calories are the right kinds of food to support a nutritious or a healthy lifestyle. So making sure that we have both a quantity and quality food needed. They need to be flexible, and 2020 is, a lesson in flexibility. And so they need to be able to move as our community works, and to be able to help and accommodate people, whether they can come to you or you need to go to them. I see that I'm on time. So all of these slides are available. Just the next slide. Another really important part of our model is just to make sure that everyone can have the tools to recognize food insecurity, and that you have the infrastructure to meet people when and where they are ready to identify that they need help, and to ask and access that help. So we've been training our partners across sectors to integrate screening into their spheres, and help to break down stigma and make it part of the normal culture. And that is a huge part of the community aspect. The last slide, please. And the final note that I just want to leave you with, we have learned in 2020 that charity does not equal equity, right? And while I value and our system relies on the charity of many generous individuals, what we cannot deny in 2020 is that a charitable food system will never provide for equitable or universal food access. And so just like we would not rely on charitable grocery stores, we cannot rely on a charitable safety net. We have to invest in the infrastructure. We need to have a balance of paid staff and volunteers. We need to make sure that this is sustainable in good times and in bad. And we must be able to trust our neighbors just as we ask them to trust us, so that we don't have to worry about needing to hoard or stockpile food in our bunkers, but that we know that this is going to be available for times when we need it most and not. So hopefully, the last 5 years, the folks on the panel here have been part of a louder and louder drumbeat to raise awareness of food insecurity. And as a result, on March 13th, when our schools shut down, how many school districts you've heard are mobilized to be able to provide that kind of assistance? That didn't happen by chance, but we see in the communities where they have infrastructure and they don't, how we are experiencing this pandemic very differently based on income, based on class, based on race. And so hopefully we can harness the attention that we have to be able to continue to go forward and work on what has worked well, build on what's worked well in this crisis. So with that, thanks.
Thank you so much to our panelists. We have a few minutes for some question and answer here, and I wanted to start out with a couple of questions that have come in. I'll ask both of them. I'll start with you, John. Our previous session before this breakout, we saw some great data coming out of UVM showing the increases in food insecurity during the pandemic. In those kind of quantitative terms, you're kind of on the ground providing these programs. Does your experience with the Vermont Foodbank support those numbers that we're seeing coming out? And then Mike, if you could talk after that a little bit about if you're seeing kind of new families taking advantage of the food pickup programs, do you feel like you're reaching new families who maybe haven't utilized food support in the past? We'll start with you, John.
Yeah, the short answer is yes. When we saw this huge increase in need and people coming looking for food resources, starting March, and the UVM team quickly got on, created this consortium and started doing research, and it not only coincided with what we are seeing on the ground, but also with the national research that was being done by Feeding America. And I must say that the research is very, very helpful to us, because it's great to have anecdotal evidence that people need help. But when we're talking to donors, and particularly more sophisticated donors and foundations, having that data and that local data and having it consistently available makes a huge difference.
So your question to me was about if we're seeing new clients, new people, new faces. I can only answer that in the most anecdotal of ways, because our system has been designed deliberately with zero barriers. And for us, the initial barrier would be just writing down your name on a piece of paper and saying who you are and how you got there. We have zero tracking for that. The only tracking that we actually do of any kind whatsoever is we ask our volunteers when they go out to tell us how many individuals or families came to get food. And if you handed out face masks and sanitizers, how many did you hand out? And that's about it. But what I will tell you is that by virtue of where we are in the community, you have to be seeing new people. It's just got to be that way, because traditionally we have, like most communities, very fixed locations for food resources. be it the local, the local pantries, for example. Now we are extending their reach by being in lots of different locations in the community where people can literally walk out of their apartment building on any given Wednesday at 11 in the morning and go get a bag of groceries. That's new. So there are definitely new people coming. What I will say also is we did one of these drive-through events, like John mentioned, the Farmers to Families program from the U.S. Department of Agriculture. We hosted one of these events a couple of weeks ago, through a partnership with the school district. And we were supposed to start that event at 11 a.m. We had told people they could start to queue up with their vehicles around 10:30 if they wanted to. We would open the doors at 11, and we expected to be done by 1. We had enough food for 1,200 families, each one receiving about 30 pounds of produce and protein. I have never seen that many cars in my whole life, and I know that those are not many of those people are not people who normally frequent the food bank or the food pantry. So yes, we are extending that reach, and mostly that's by reducing the barriers of tracking data, which has the downside of you don't know who you're talking to.
Yeah, thank you so much, Maggie. I think that was really helpful response. We have just a couple of minutes left here, and I wanted to shoot one question to each of you. If you could take about 1 minute in the time we have left to comment. You've all talked a lot about kind of pivoting to meet needs, how needs have changed, how you've stepped up as people have expressed what they're going through and kind of listening to the community. And you've all talked about the work you're doing across sectors with the governments, with healthcare. We could see it through this poll we did. We have a lot of people from different sectors here with us today. So I'm wondering if you could talk about how these programs have benefited when your approach to partnerships. And in particular, have there been any unexpected partners or people who have stepped up with new interest in food security issues this year during COVID? I'll start with Lyndsey. You're muted, Lyndsey.
Still on mute. I think our partnerships were the backbone of our ability to respond. And, one thing I will say is that it's not just enough to partner based on goodwill. And what we learned actually a year ago through our healthcare partnerships, actually using some data from the Food Research and Action Center and other groups who are polling physicians across the country, that it sounds basic: provide food, eat food, be healthy. But the vast majority of people in healthcare are not trained about nutrition or trained on how to integrate food into healthcare. And so it was a year's worth of training that we had done. Some of it actually had been funded by our local United Way, to train teachers, all of our school nurses, to train our pediatricians and even their billing staff on recognizing and responding effectively to food insecurity. And that's what allowed us to be able to pivot. So it's not just about, yes, we're all mobilized to do this. We have to be willing to educate people so that they feel confident that they're going to, when they ask someone if they need help, that they know how to respond. And so I think that that's one of the key things that we felt really helped us pivot right on day one, and to sustain that through.
Thanks. John, what about at the food bank?
Absolutely, new partnerships. The really deepening our work with the state of Vermont has been a big change, and I hope that all of these will continue on. Working more closely with our local farmers and food makers, and the kind of the restaurant. We have Everyone Eats in Vermont, which is restaurants being funded to provide meals, tying them in more with the local food systems and with the the charitable food system. And one of the really interesting things about existing partners is the depth of the sharing, and that we all, and Mike said this earlier, you know, we're not worried about competing for resources. We're just worried about making sure that the resources that are out there are getting to the right places. You know, the food bank has been actually sharing the grants we're making and with the Community Foundation and United Ways and some others, and we kind of have a master list just to make sure we know who we're working with and where the money's going, and making sure there are no gaps. Again, I just can't emphasize enough how this has to become the new normal, and it's going to be my mission to make sure that it does.
Thanks so much. And really quickly, my Granite United Ways partnership approach in our last couple seconds.
Well, first of all, I'll say we're not Granite United Way. That's another United Way.
Sorry.
We're the United Way of Greater Nashua. But thank you. I'm honored to be on the podium with my much larger brother to the north. Yeah, so one of the beautiful things about the Zoom world is it allows us to multitask. So while we're in the middle of this presentation, I've got emails coming in left and right. One of them that I received about 15 minutes ago was from the pastor of First Church Nashua. First Church is one of those locations that has never had a food pantry before until about 3 weeks ago, and we started serving food there through our pop-up, our winter pantry. He was inquiring about what we were planning on for next Wednesday, which is Thanksgiving Eve. I emailed him back and said, yeah, we're definitely planning on it, but good question. I emailed the Boys and Girls Club and the YMCA to see if their drivers were going to be able to help us out that evening. Within 5 minutes, both of their CEOs got back to me and said, yep, we're in for next Wednesday. And the soup kitchen confirmed that they'll be available to pick up food. So for us, partnerships, it's just how we roll, you know, and I would echo what John said. We want to continue this for a very long time. We forever and a day have had this mantra about living united. To me, this has been so gratifying to see my community come together and really show that great things can happen when we live united.
Wonderful. Thank you so much. And sorry, we're just out of time. Wish we had more time here, but this brings us to the end of our 3-day virtual conference. Please complete your evaluation, but on behalf of the conference organizers at Dartmouth-Hitchcock, New Hampshire Public Health Association, and the Vermont Public Health Association, thank you so much for attending and for all of your work. Thank you very much for joining us. Stay well, be kind.